Hi, everybody. Are you excited for another podcast? I am. I have my new and best buddy, Summer DelSignore. Yes, that's how you say her name. And we are going to deal with kids today. Summer is a nurse practitioner, and she is a board specialized person in pediatrics and deals a lot with kids with Lyme disease. So not only is she taking care of these kids and other complex issues, she's got to deal with the parents, and we all know that can be a tough struggle. She's very well respected, well educated. She's also worked and trained with our favorite doc out there, Dr. Horowitz, and she's going to tell us a lot of information today that may help any of you out there who have kids that are struggling maybe with Lyme disease. So I'm excited to introduce Summer. Hi, Summer. How are you?
Hello, Cindy. Thanks for having me.
We are excited, aren't we?
We
We are.
That's quite an introduction, let me tell you.
I'll tell you. I was thinking.
I love it.
Yeah, I was thinking to myself, my God, how am I going to one up this beautiful chick? And I don't think I can. So, so we're all in the midst of being hunkered down with this COVID-19, and we don't know when the end's going to be, and we're all nervous. And so, amongst all that, this is a nice distraction. Yeah, I've put up even some podcasts that are not released on audio. I've put them up on my YouTube channel, and we'll see if that just keeps people entertained for a little while.
Sure. Well, if anyone can do it, you can.
Oh, so let's talk about you. Let's talk about where you're practicing, how you got into the kiddos, and we'll start with that.
Okay. Well, currently I am at Bach Integrative Medicine. It is in Red Hook, New York. So it's about an hour and a half, 2 hours north of New York City. It's an interesting journey in pediatrics. When I was going through training in school, I knew that I always wanted to deal with kids, always. And that's where I started. First job interview was a new grad, you sort of, before the NP. So you're going through the RN, and it's sort of like, hey, you kind of take whatever job we give you, you're a new grad. And I said, no, I'm going to take pediatrics. Well, what if we don't offer you? Then I guess I don't take anything. And that's how that came to be. And I've been in pediatrics for 18 years now. So I practiced general pediatrics and then pediatric ICU, and decided I wanted more. So 3 years into my RN career, I decided to go back to school. So I was an RN for just 3 years, and since then I've been an NP. I attended the University of Pennsylvania, Philadelphia. So the Southern Bell moved up. It was an interesting transition. I chose them because they have a very competitive program. They are connected to CHOP, the top hospitals in the country, much like Boston Children's. They just have some really great innovative treatments that they provide, tons and tons of education and research. And
CHOP is the Children's
Hospital of Philadelphia. Yes.
Okay.
Apologize. Yes. That training was in pediatric intensive care. And interestingly,
that's rough.
Right.
I don't know how you did
sick
that.
Kiddos.
That's rough.
Yeah, as a mother now, I don't think that I could as easily, but before babies, I could disconnect enough.
Before babies.
Before having babies. And now it's a little more difficult to see them that sick. But interestingly, after finishing studies there, we just kind of followed my husband's career for a while, and I didn't work in peds for a long time. I was an administrator. And then, wow. I know, I know. He's taken me all over. It's quite a resume. I look a little, like I have ADHD. I really don't. It's his fault, I promise.
You look like
Uh,
a heavy what?
I said, I'm sure my resume looks as though I have ADHD,
Oh,
but yeah, but it's his fault. He's taken me all over. But I digress. But a stint as an administrator, which you always gain skills in everything you do, and eventually we made our way to New York. We've been here for about 12, 13 years now. And that's when I transitioned back into practice. It was time. And I started in a primary pediatric office, nothing integrative whatsoever. Stayed there for a few years and then started asking the why questions. Well, why are we doing it this way? I realize what American Academy of Pediatrics says, but I know what I'm seeing in my office, and this isn't working. And we like the warm fuzzy boxes, right? It's nice, it's easy, you know what to expect. But we started seeing things that were outliers, and those outliers grew to become the new norm with some kids in our area. So, several years later, I transitioned into an integrative pediatric practice, which was the provider who ran this practice. It was kind of taboo to say his name because, it's integrative medicine. It's different, and we always reject the unfamiliar. I mean, quite honestly, because it's just basic common sense type things. Well, you're congested, maybe don't eat dairy. I mean, that's not, anything far-fetched, but to some, you're really going against the grain.
right. You're not practicing standard of care.
Right. And again, there's nothing wrong with standard of care, but you have to address the outliers always. I continue to ask questions. I find myself to be that eternal learner, that forever student. Those questions led me down the Lyme path, which was not somewhere I thought I'd ever go, to be quite honest with you. And again, seeing the trends in the office. So as an integrative practice, we saw a lot of kids with autism spectrum disorder, autoimmune disorders that couldn't be explained despite the specialists that they had traveled to, lots and lots of behavioral mood disorders that weren't responsive to medications, the typical treatment. And I would ask the question, well, why? What can we do? What are we not doing? Just by chance, I met Dr. Horowitz, and his office was 5 miles up the street from mine.
Really? That's amazing. He's a hard guy to get around.
Right. And I met him at, it was in Rosendale. It was at Wild Earth, and it's this really cool place. They provide this very outdoorsy sort of camp, that not somewhere at the Southern Belle where stilettos would be. So it was really kind of interesting.
You know what's going to happen. If it's an outdoor camp, you're just going to slide into the dirt.
That's right. Yeah, I didn't wear
with stilettos on. Yeah,
I didn't wear the stilettos. But I met him at this conference. I was asked to speak about pediatric Lyme and just kind of, give an overview to the campers and the parents and the counselors, just to bring more awareness. And this is where I met him. He, full of energy and life, says, "Oh, Summer DelSignore, I had to meet you. I love the name. I had to see who this person was." And it started a conversation, and then from there he invited me to come train with him.
nice.
And that was that, and that's how that started. So it was just, things just fall into place, as they're supposed to.
Yeah, that's great. Now, how long ago was that?
Where are we now? Maybe 5 or 6 years that I trained with him. So I was treating integratively from pediatric Lyme and chronic illnesses before then, and just kind of figuring it out as I went along. Knowing that there isn't a great deal of pediatric research out there at all. So that led to where I am today, and that's all that I treat.
Just Lyme.
Pretty much just Lyme and other tick-borne illnesses, autoimmune diseases, and then autoimmune encephalopathy, so PANDAS, so the neurological component to it. And that's my specialty at this point. So it just sort of was this evolving thing, and I just went with it.
Yeah.
I didn't force anything. I just went with it, and this is where it landed me.
Yeah, it
So
sounds like a calling. It sounds like, it just was a destiny that this
sure,
happened.
sure. And looking back, I don't think that I would have envisioned myself being in the position where I am now. I really wouldn't.
Yeah, you turn around and you go, how the hell I get here
How
anyway?
did I get here? I'm dizzy. I'm so dizzy.
This is just the way it is. This is the way it is. Kids are not little adults. We used to
No, not
think
at
about,
all.
right? We used to think that
Hmm.
they were just midgets. You just
Right.
kind of have to dose them just with smaller things. You just don't
Right.
half of what
Right.
you gave an adult or whatever. But what's the biggest part of that concept regarding their health issues when you're dealing with kids? What's the biggest issues that you think kind of hold back general medicine from caring for them?
There are many issues. The main one or one that's actually coming to light now is the mental health component with children. We're missing it on so many levels. And I think that that's where the mentality is still that, oh, well, they're little adults versus, you know, kids. So what we're finding is that we don't have a foolproof way of, and medicine's not foolproof, but a more standard way, I suppose, of really assessing and evaluating. It's primarily a parental report, and then with that, providers inject their own biases. Well, this kid's just a parenting problem, or they're just having a tantrum, or they're spoiled, or they just want attention. And, to their point, some do. We know that. But I find in my practice that many parents are told that their children are problems rather than that provider saying, well, let me roll up my sleeves, let me dig in, and let's see why this parent is so concerned about their child's behavior, why they feel that this is atypical from a normal, toddler tantrum. And that seems to be the main problem. And that's where most of these kids and parents find their way to me, because they've been through 10, 15, 20, 30 different providers who are, passing judgment, really not digging in to test them to say, well, let's at least do some rule out. And then if we've ruled things out, if we tried treatment methods, if we've modified environment, and we still have this, maybe it is a primary behavioral problem, but we really need to work at this and evaluate. So they just sort of get brushed to the side. Um,
Do you
so it's
do you think it's the one of the problems is that mainstream may be too quick to prescribe medications?
Oh, absolutely, absolutely. It's easy. It's easy
Well,
to
it's
try.
easier to care. That's what it's all about. It's
Right.
to care.
Right. It is. It's easy. And then, I try to kind of maintain the balance and understand that providers too, especially those who are relying upon insurance reimbursement, they have 10 minutes with the kid to evaluate. It's difficult to really understand what's going on in a 10-minute window. So in their defense, yes. So yes, it's easier to say, well, here's your Luvox, or here's a Ritalin, or what have you, rather than saying, okay, environmentally, tell me what's going on. What's going on with their environment? Are they reacting to certain foods you're giving them? Have they had any recent exposures? So initial consults with me are 90 minutes. So
Yeah.
I have an
Yeah.
hour and a half to go through this, and it's integrative, it's comprehensive, it's head to toe, it's evaluating every potential exposure risk. And again, mainstream medicine who will take insurance, they have 10 or 15 minutes tops. So it's just the way the system's set up. It isn't set up for chronic illness. It's for acute, and that, and you can apply that to the entire, lifespan, even into to older, adults. That it's easier to prescribe a medication and just stack those meds and hope that something sticks.
Right. Right. I
Right.
always talk about primary care at this point are pushed to be just putting out fires. That's
Correct.
really what they're able to do. And when it comes to practicing this way, integrative, functional upstream approach, it takes time. And
Mm-hmm.
when I'm asked, why aren't you taking insurance? I take a deep breath because I want to present this appropriately.
Mm-hmm.
And my answer is, if I were to become a insurance-based practice, I would never have the time to practice the way you need care right now.
Right.
Because you want to pay your $45 copays and then hop from this specialist to this specialist to this specialist, and no one is coordinating your care. That is something that you can choose to do. But if you really want one practitioner that is going to look at you, like you said, Summer, head to toe,
Mm-hmm.
and incorporate a lot of the pillars, the important pillars, the environment, the stress, the sleep, the nutrition,
Right.
all the movement. I try not to say exercise, but I laugh because when I say movement, some people say, well, I go once or twice a day. I'm like, that's great.
Oh, yeah. To clarify that a bit.
Yeah, the movement. I like to keep people with movement. But anyways, the point being is that your health insurance now has become something like car insurance.
Mm-hmm.
It's there in case you get into an accident or something serious.
Sure.
So when it comes to your regular maintenance, you're going to have to decide if you want to have something more comprehensive, or if you're just going to wait and deal with one problem at a time. We know notoriously that our men end up in the emergency room because of a catastrophe, because they didn't take the time or the energy or note certain changes beforehand. And then all of a sudden it becomes, it becomes
Sure.
fire.
Mm-hmm.
That's
Absolutely.
that's tough. Do you have trouble explaining that, or are parents at this point like, I'll do anything?
At this point, they're desperate, and by the time they make it to me, they've researched quite well. They're well versed in what's going on with their child. They bring research with them, and usually a 4-inch binder of all of their health history and labs and anything else that they've had from specialists. So they know. So it's a tough crowd to appeal to, and it's
Yeah.
yeah.
Do you sometimes feel like, oh my God, they're teaching me, right?
Well,
Right?
and we have that discussion, and some of the things that I always, discuss with the parents is, one is, I will always trust your intuition, even if I don't have anything clinically to base it on at this time,
Yep.
but we'll continue to dig. And
Yep.
two, I love to educate. It's definitely a fluid relationship back and forth. And if there is something that you find, because I can't spend all day on the internet either researching, but we'll have just the discussions, because I want them to be experts as well. I want them to be able to identify this. So I'm very comfortable with that and confident. And it's never viewed as a threat to me. I'm always open to it.
Excellent. Because they get to buy in, right? Because,
Right.
we're looking for the whys, but
Mm-hmm. Sure.
they're asking for the whys.
Mm-hmm.
Right?
Absolutely. Absolutely.
Why did this happen? It's been so long, and kids,
Right.
their childhood is so short if you really think
Oh,
about
absolutely.
it. And
Absolutely.
you can't, I don't know, you can't delay, as much as
Mm-mm.
sometimes it takes a while to figure things out, you just can't delay. And sometimes, like you said, the food stuff, it's amazing. Kids' behaviors, especially
Sure.
associated with food coloring. Do you see?
Absolutely. Absolutely. That's one of the first things we'll tackle once we've kind of addressed the acute issues that
Mhm.
are coming in, is to say, all right, we know gluten and dairy are inflammatory. Food dyes are inflammatory. And I spend a great deal of time educating to say, I don't mean inflammatory in the sense that you're allergic and will develop hives to these things, because I have many parents saying, oh, well, they're not allergic to it. Well, I'm not talking about allergy per se. I'm talking about the inflammation. These foods, if you're not getting, organic, GMO-free, kind of products, and many people don't, either they don't have the access, can't afford. And I think as we evolve over time, we lack more of those enzymes to deal with these types of foods. And then certainly anything foreign. But I find that those will, can prove to be detrimental to some children. And I find that there is many times an underlying imbalance in the GI system related to these things. And many times kids have genetic SNPs that contribute to it. Why, yes, their friend next to them can have a red popsicle with red dye number 40 and God knows what else in that thing, and not react. And then, the other one can just be sitting there next to it and their face flushes and ears turn red, and, then they're hyper and they're moody, so I find that there is a genetic link, as well as some of those artificial substances that are peppered throughout the standard American diet. So that's definitely a hot topic with me, is the diet.
Food first, right? Food first.
Right. Absolutely. Absolutely. It's all about preventative. And anything you can do to clean things up, that's less trips to the doctor's office. That's less intervention in general.
Right. And you know what? Sometimes it's so hard. It's difficult to make those changes,
It can be. It can be. But, I use my own personal experiences with my patients as well. I need them to trust me. I do the same thing at home with my kids. And they protest, and my daughter threatens to go to her friends' houses and eat bags of Cheetos, in protest. And my mother-in-law laughs that she doesn't recognize any brand of cereal that's on the shelf at home here. And, and it's okay. My son is affected by it, so the whole family lives that way. And so everything is organic and GMO free and dye free, and, as many whole foods as possible. So, I chuckled, when, this whole coronavirus thing swept through and started. And again, you have to kind of make light of it in some ways too. I know that many people are suffering, but when I was going to the grocery store for the first time before, everything was gone, I didn't really have problems shopping. So I was shopping and buying all the whole organic foods and all the organic stuff on the shelves. And I'm like, well, this isn't affecting me right now. We're kind of cool. But, all of the bags of chips and all the canned soups and all, the toilet paper thing, but the, the regular tuna and all this other stuff, it was all gone. Everything was gone. But I kind of went through happily, and I'm just getting my normal stuff and no big deal,
That's all you can do. I mean,
all you can do.
There is produce. There was no frozen vegetables. There was.
I noticed that as well. Even the organic stuff was gone. Even the expensive stuff was gone. Yes.
Yeah.
But
I don't know. I mean, we're all in this together.
Absolutely.
It's funny because on my page associated with the podcast Living with Lyme Facebook, I posted, I had to do this. I went on to YouTube and I got the clip from Seinfeld that says, "Can you spare a square?" I thought that would be perfect.
I love it. I love it.
So I put that on my page. Everybody's got to laugh, but there are some really funny things going around now. And, I think our humor is probably a method of comforting ourselves right now, because it's just crazy, and a lot of people are asking, hey, and I'm thinking this through. A lot of people are asking about, are you at more risk if you're suffering from something chronic like Lyme disease? What do you think about that?
I think that perhaps, yes. I think that it really comes down to inflammation. So if you have Lyme disease, if it is well controlled. If you're very cautious, I don't feel that you're going to be at any higher risk. It's those who don't really have a handle on it, who have other underlying issues or have been completely dumped against their will in that autoimmune bucket.
Mhm.
Those are the ones at risk. Those are the ones who have higher inflammatory markers by nature. Those are the ones who are going to have elevated D-dimer levels and SED rates and things like that if you test them after they get this virus. There were some recent studies, I think it was by Lancet, showing that from the wave through China, they had a cohort of patients and they examined factors that would contribute to the high risks. So those who survived and recovered, and then those who succumbed to the virus. And it all came down to inflammation. So these are people who became septic very quickly. Their inflammatory markers were very high. They had histories of autoimmune disease. They had histories of hyperlipidemia and diabetes. So all these autoimmune inflammatory kind of conditions. And that led them, because coronavirus isn't just lower respiratory tract. It gets into the other organ systems. It gets into the gut. It gets everywhere. And it evokes this massive cytokine response. And that's where it's going to differ from the flu. You kind of feel the flu coming on. You seem to be, from an immune perspective, able to get a handle on it. So, coronavirus, we know that most coronaviruses cause the common cold. And then there are those few that cause those, like what we're dealing with now, very serious respiratory ailments. I don't think that, given this particular strain, that the body has time, when it's already on edge on a regular basis, to deal with it. It doesn't have time to recruit the proper T cells and B cells and to deal with the inflammation. So long answer, yes, they're at higher risk unless there's, reasonable control and someone is very good at maintaining cytokines in their body and detoxing appropriately and following those precautions.
Right. The detox is important because we're toxic in general.
Absolutely.
Our environment has now and what we're eating and all that. But listen to this. Mm-hmm. I'm thinking of this and, I'm listening to all the advice coming out, and now that we just started spring here and
mm-hmm.
the weather's going to get nicer, whatever, I'm like doing the cringe because I'm thinking, okay, more people are going to be outside, more people are going to hike, unless they're made aware or they're diligent about tick checks.
Sure.
We might find ourselves with yet another type of epidemic.
Absolutely.
I'm nervous about that. I really am nervous about that. So, trying to encourage people to really be cautious is probably one of the most important things we can do. So I'd like to shout it from the highest mountain and hope that it reaches land.
Right. And I'm always concerned when we have mild winters, as we all have.
Yeah.
It's been very wet. It's been very mild. It's been miserable. It's not cold enough to have a great ski season. My husband was very bummed about that. I was thrilled because I just go along with it and pray to God that I'm not going to break my neck on these stupid things. So I'm concerned that we didn't kill off, some of those ticks that you expect to occur in very cold conditions. Yeah. I found one on my son the other day. It was just crawling, but they're very diligent about checking themselves, and it's just in the backyard, and the grass is not high. It's not growing. They're not hanging out in the brush, crawling on his back already. Here we are, here it starts. So, people need to be diligent. I think that after all is said and done with the coronavirus, I think people will have a healthy case of cabin fever and chomping at the bit to get out, and will just be relieved that they can, and perhaps won't think about it. So,
So are younger kids more at risk or have certain other predisposing issues than children as they get older. So what I mean is, I've read that boys between the ages of 7 and 17, and don't quote me on everything I say, but they're a real high risk category. Now, would you think that that extends to young girls? Do you think that, well, I'm seeing a population more like, 6 to 10-year-olds? What can you add to my sort of a question that I'm trying to
sort of a question. Okay, let me see if I can tease through this. The boys are higher risk. Probably, it's really more an environmental kind of a scenario. Typically, the boys are out a bit more, active, and we're talking about the younger boys, and they're just not as mindful. So if you think about the activities that you would associate with boys, they're out in the woods, they're playing sports, they're doing things with their friends, and I think that if we really looked at those numbers again, because girls are now out and about more than they used to be, it's probably neck and neck. So I think that it's really just more of an environmental exposure risk. I don't think that there's anything significantly different with the immune system that would make them more susceptible. I don't know if they seem more delicious to ticks than girls. I can't answer that. But I think that it's just really activities, behavior in general.
Yeah.
But again, girls are playing more soccer and lacrosse and out there too. So I don't know that there's really a big difference, if we really looked at it again.
When I'm a family nurse practitioner, so I have all ages, and I struggle with that tween to teen because they miss things in terms of outlines. They either forget or think it's not important. They're just generally poor historians. And you have to get really crazy creative to try to get the right answer. How do you do it? You have any tips for me?
Well, I will, I always ask the parents, to assist with that, but I direct all of my questions at the kids. And I have a 14-year-old myself, so I feel the pain at home as well. But really I start with very objective questions. Let's start head to toe. Tell me how you feel. And then I get a blank stare. I was like, okay, well, let's start with your head. Head, shoulders, knees, and toes. So head, how does your head feel? Well, my head's fine. Does it ever hurt? No. Do you ever have headaches? Oh, yes. So they're thinking, generally, does my head? So you have to just kind of dig until you get a yes, no, and you don't have the deer in headlights look. Well, all right, while we're still on your head, do you ever have issues concentrating at school on your work? What do you mean? Do you remember information? And then kind of go down that pathway.
Oh my God, that's awesome. I love it.
So that's what I do. I never ask them if they're moody. I assume they are. I ask the parents, do they seem to be over the top? Are they having tantrums like a toddler at 14 and 15? That's a little bit out there, but the normal moodiness, yes. And that's probably the most difficult, when you're assessing them for Lyme disease and co-infections. There is a heavy neurological component with kids that you don't see with adults. And when they're teenagers, it is difficult. It is difficult to tease it out.
Yeah.
So you just have to kind of keep digging and kind of splitting those hairs and asking the question and re-asking the question in a different way until they look as though it registers with them. Oh, that's what you mean, kind of a thing.
What a great tip. I like that tip. I like that because, it forces these youngsters to really, it forces them to think, but, you really, like you said, you have to ask the question in a couple of different ways. The thing about that is your head hurt. I don't know why they don't think a headache is, your head hurting, or not your head hurting, but whatever, right?
Right. But, in that age group, they're very, as they should be, they're very egocentric, and they have this sense of being invincible. So they don't think about it, and And, on the flip side of that, there's a lot of kids who have had this, tick-borne illnesses, perhaps from mom, that there may have been a congenital exposure, and feeling the way that they feel is their norm. And they don't think that that's, that there's anything abnormal with what's going on with them.
Right.
So you have to assess for that too.
When I spoke
Mhm.
with Dr. Bransfield on a
Uh-huh.
podcast, he said, yeah, kids just don't have a point of reference.
No,
And
no.
really, I was like, wow, that's true.
Hmm.
That's the way they knew, the way they normally
Right.
are is maybe not so normal. Uh, that would be, that would be,
Right.
yeah, that would be helpful. But again, if you think about it, I mean, I'm older than you. I can really understand a lot of things now that even 10 years ago I didn't quite
Hmm.
comprehend.
Hmm.
Especially, relationships and talking with people and listening. I think we have to listen a lot more
Hmm.
today than we ever did before.
Right. Right.
Yeah.
Absolutely.
There's subtle things that they say. And, I have a recent parent child interaction. Of course, at this point, I'm doing video conferencing.
Uh-huh.
Um, the parent was like, go ahead, tell her. And then, of course, the daughter's like, tell her what? And I'm like, you know, God, slap, slap, slap. But
Right.
yeah,
Right.
maybe there's some, things that kids don't want to talk about because maybe they're embarrassed or uh, maybe they were hiding some things. They don't want their parent to even know that
Right.
they haven't.
Right. And in those cases, I always, get permission from parents to say, do you mind if I chat with them briefly? Are you comfortable with that? And, if there were anything serious, then certainly I'd have to inform you, but maybe they'll be a little more open. So I try to quickly become friends with my patients, with those kids, to gain their trust, to share some goofy stories about myself as a kid, to share stories about my children, just to relate, to say, it's okay. I'm a person too, just like you. No
Right.
one's perfect in this room. No one expects you to be, and really try to gain that from the very beginning. Otherwise, we're not going to get anywhere. You know that. So,
Yeah. Do you have to use different treatment strategies when dealing with children versus maybe what I have to do? I mean, is there some other approach? I mean, we definitely understand that, kids might not be able to swallow pills or, they're
sure.
very picky with their taste and those kind of things. But is there other treatment modalities and strategies that work better for children?
I find again that, because to answer your question, yes, there are different modalities.
Hmm.
Again, seems to be a larger neurological component. So I try to use medications that give me more blood-brain barrier penetration. I treat every child, and my child is from 0 to technically 26 if they have chronic illness. So I
Wow.
look at all of them as, okay, from a compliance perspective, what would a 5-year-old take from me? And I treat everyone the same in that sense of how can I condense this regimen? So I'm looking for medications if they're old enough to take those meds. With doxy, if they're old enough, I will give them a higher dose of doxy. I will, and the older kids, I'll double it up. And certainly following monitoring labs, making sure they're clear and giving them tons and tons of supplements to detox their kidneys and their liver. We never put them in danger. Things like minocycline, and then we'll give Plaquenil to help increase levels of certain medications intracellularly. And then I have a huge belief system in really treating them integratively. So it's in addition to the medication regimens, I am also giving them herbals that get in there and help enhance that. And then giving them things to support their immune system. So many of these kids, again, have had this congenitally. Some of them never recall, parents and kids never recall an exposure. If the parents look back, we'll say, hey, they've always had something. But then it's always been blown off as, well, you're an outlier developmentally. There was never thought if there's an infection. So I assume that everyone walking in, unless they can say, yes, I had a tick bite on this day and this is what happened, that they're chronic or have had, some issues or have had former exposures. And so everyone is treated pretty aggressively. Many of the same meds that you would give to an adult, I can. It's just weight-based with many kids. And, and I find that eventually I like to transition the kids over to more herbal and homeopathy in an attempt to temper the immune system a little bit more and really support them. So in the back of my mind, I'm always thinking, what am I doing to their gut, as I give them these medications. So it's a little different. It is aggressive.
Yeah. And
yeah.
it's not short term. This is something that
No.
you're going to take, it's going to take a while.
Right. Absolutely. And I try to rotate the meds through. I try to give them breaks and just do herbals for a while, really creating sort of this assault on these bugs, and while also giving the kids a break a little bit.
Yeah.
But I find if you're going, treating children and you want to, get the best outcomes possible, you have to be incredibly aggressive and assume that you may get a solid 4 to 6 weeks of treatment out of them, and then they're going to start pushing back. So, I hit them like a sledgehammer essentially with the treatment once we have a good sense of what's going on, and knowing that I'm only going to get a good month and a half out of them before they start pushing back, no matter their age. So it's kind of get in, get out as quickly as possible, and then hopefully get something, maintenance on board. It is what it is. There's the reality of it. There's what you really want. I'm a realistic person, I'm a realist.
So all in all, do you think you have more difficulty with the parents or with the child patient?
It's the parents. I'd have to say it's the parents. Just they're conditioned to view things in a certain way. And the parents are great and they're loving and they want the best for their kids. But it's, Google and some other search engines can be a curse or a blessing. So they take it down these rabbit holes, and you have non-medical professionals, non-experts who are looking at, well, I saw this study and such said this, or my Facebook platform group said this. I'm like, that's fantastic. It's great to research. It's great to educate yourself. It's great to have a support system. However, we've got to work on a trusting relationship. You're coming to me as the expert. Let me help walk you through what you're reading. Let me show you how your child's different than, this one case that you read online. It's sometimes it's difficult to convince parents that this is a multifaceted illness, that it's affecting every possible system within that child. And every case presents with a different spin, every one of them.
Right.
So,
it's so complicated. And I think, there's one thing about having the infection, but I think especially with kids, and if they've had it since they were, a prenatal exposure, then it's collateral damage. I think that, sometimes people will come in after they have had treatment for, if they were lucky, 21 days, but they weren't sure maybe how long they had been sick before. And then after their 21 days, they're better. So they didn't do anything. And then all of a sudden they're not good again. And I don't know. We can always determine some level of inflammation by certain lab tests, but I really feel like all of what goes on after is just the immune system had gotten so ramped up and it just won't calm down, and the body is totally inflamed.
Right. There was a study, and I pulled it. It was Brian Fallon. You may have seen it.
Oh yeah, I know Brian. Yep.
I love Brian. And he's, he really produces some amazing work. And I just, and I do chat with him every now and then about certain things, and what he's seeing, and he's always so insightful. But he and his researchers just recently published the whole autoimmune encephalopathy PANS connection with Lyme. And they were using the Cunningham antibody testing to say, it was great that he would tease out those patients who were acutely exposed, those who were chronic or post-Lyme disease syndrome, however you want to dice it, and then those who were re-exposed. And he could correlate all of those, neurological inflammatory markers with the exposures, and then watch them and monitor those markers as the patient was treated. So there was this direct correlation to show, yes, we're seeing neuronal autoantibodies spike with an exposure, and we see them go down when we treat. And those you can't just grab from a regular blood test. So you get a SED rate and a complement level and ESRs and D-dimers or what have you, and they're going to be normal because it's the disease process has moved on. So we're really looking, from, like I said, with kids and the neurological component, that's what we're seeing. So yeah, there is that pathway of destruction.
Yeah.
And it seems to be neurological.
What was his basis for measurement? Was he doing brain type scans, or?
Not in this one in particular. And he has some really great brain scan correlation with, inflammation. He was using a blood test. So the Cunningham panel, he was using it that tests certain antibodies, autoantibodies, that are significant to the neurological system. So these antibodies will attack the neurosystem. They're higher. So he was watching those levels and correlating those levels with treatment, and then again, breaking out those patients to say it's not just acute, it's post-treatment. If they haven't had treatment for a while, it's re-exposure. We're seeing a direct correlation with Lyme disease. Now, he didn't test co-infections. He just focused on Lyme. He had to keep it simple. But we were seeing those levels go up. So he has the study, it's in brain behavioral and immunity, I think, fairly recently in the past year or so. So the study's there, but it's fascinating. It's fascinating to see it. So, and exciting. I'm hoping that more providers will kind of jump on that wagon. Many still view the Cunningham panel as controversial, even though there's an NIH, Susan Sweeto and from NIH, very respectable, and still she gets pushback. So, it is what it is. But he was showing that correlation that, yes, there's this ongoing autoimmune response, and, chose to focus on the neurological. But I think from a full systems view, there's an autoimmune response that occurs with this exposure. And then the question becomes, well, and this is a question that I'm now asking, is it really chronic Lyme? And on that platform of chronic Lyme persisters dormant, which is quite possible, or is this the leftover autoimmune component? And now we have to look at reversing that, which in my opinion is much more difficult than just treating an acute infection. So that's kind of where I am at the moment, and looking at some of these patients to say, well, if we give the antibiotics, many of them have anti-inflammatory components to them. Doxy's an anti-inflammatory, Plaquenil's an anti-inflammatory. We use it for rheumatoid arthritis and other autoimmune disorders. Is that what's helping them, or is it still going after the bugs? So, and I haven't been able to answer that yet, but it's that question. That's my next big why question.
Yeah. We have a lot of trouble in this area, Western Mass, with pediatricians.
Oh, I'm aware.
Oh, well, yeah, probably. But, it's very disappointing and disheartening when someone writes into me saying, I need help. I don't know what to do. My 18-month-old, I didn't give a bath last night. And when I went to put her in the tub 2 nights ago and then put her in the tub last night, she had an embedded tick. So did what they were supposed to do. They took it off. They sent it out for testing.
Mm-hmm.
It came back positive, and they took that information to the pediatrician and said, well, she's fine. She doesn't have any symptoms. I don't know what to do.
Yeah, the watch and wait mentality still, just the watch and wait. And we have that in New York too. We have that in other parts of the country who still, these are well-educated individuals who don't believe that it's a problem. But it's that watch and wait scenario that drives me insane. And, I'm always writing about it. On my blog. It's really, I don't know who reads it. It's just cathartic for me. But
That's okay.
whatever you read it, fine.
No, it's good. It's good.
Yeah. And I chat with whomever comes through the office and whoever will listen to say, please, as a primary provider, I would be happy if one day you put me out of business and what I'm currently doing because you're actually treating acutely in an appropriate manner in your office, and you're being aggressive and you're stopping this in its tracks. Right. So, but I'm beside myself as well with that watch and wait and, oh, they're fine. So let's just wait for symptoms. Really?
Right. Well, that's the problem, because you don't know how long it'll take for symptoms to come up. It could be when they're 15 years old.
Exactly.
Right? You don't know. You don't know.
Right.
But the point being is that they are, they went through this whole push for don't give antibiotics because we're going to get resistance. And they, or they think, it's a bacteria. So a 10, 14-day course of antibiotics, like anything else, it'll be gone. It's no big deal.
Right.
Yeah.
Right.
They're not educated in terms of that this is stealth. It's brilliant type of bacteria, and it does what other bacteria do not do. And take a course, for crying out loud. Go learn something. This is disheartening. But anyways, let's go back to those little ones. Sure. What's the youngest you've treated?
The youngest that I've treated was 2 months old.
With Lyme?
With Lyme, congenital Lyme. Congenital Lyme. And the mother was exposed. She tested positive while she was pregnant. We didn't treat until about 2 months when we knew the baby's immune system would kind of be functioning on its own. Tested the baby. Baby came back blazingly positive, all the antibodies.
Really?
And yeah. And because again, we know that there is congenital Lyme, but we're not exactly clear on the transmission. If certain babies are spared, what does the environment look like in that scenario? So we waited, we tested. And again, it was 2 month old, so treated and really at a 2 month, a 2 month old child, we're kind of limited in what I can give them. So we treated with amoxicillin longer term and really covered the belly and monitored them. So 2 months. Yes.
Did okay?
The baby did well. Developmentally was on target. Growth development in general was fine. I would always, as that mother, have a high level of suspicion for that child, and knowing that it was congenital. But again, the mother was exposed. I guess best case, we know she was exposed at the time. We knew to treat the baby as soon as we could, when possible. And so my hope, my positive spin is, well, maybe we did get to it. We treated for an extensive period of time, and have been watching and monitoring that child, and can only hope for the best. Yeah.
So before we end here, my big question, are children real resilient?
Absolutely. They're the best. They really are. Children, in all realms of pediatrics that I've experienced, will go. They'll go until you tell them not to. They'll go. They are still quite malleable. They are, able to maneuver around things that as adults we don't. We've already established our biases and our thoughts and our beliefs about certain things, they're still working on it. So they're still very open. So they're, I find that they're a tough group of kids. They really do bounce back. They'll do the treatments and they'll maintain this degree of positivity. And I think that really contributes to their recovery. Quite honestly, it's just that frame of mind of, oh, I'm going to be fine, and I don't have another, frame of reference. I'm just going to do and trust and move forward.
Yeah,
So,
that's so nice. That's so nice. They are so lucky to have you.
oh well, thank you.
Oh my
Thank
God.
you.
Yeah,
I
definitely.
learn from them every day. Like I said, I've always wanted to treat children, and probably because of that attitude, that behavior, that can do.
So if anybody listening wants to read your blog or get in touch with you, can you tell them how to do that?
Sure. It is summerdelsignore.com. And from there are links to that's where I post all of the blogs and other information. And then there are links to the Bach Integrative website as well that will take you there. So I think I think that's probably the best
That's
contact. So yeah, because that will give you the blog plus the main website,
good for
the
you.
contact information. So
Okay, I'll make sure that it's in our show notes when this
okay.
gets published, but we may put it out on YouTube sooner than later because we've got a lot of information about Corona. So,
Absolutely.
oh my
Absolutely.
goodness. I want to thank you. It's just been a fabulous learning experience, hopefully for those out there, but it's always a learning experience for me. And that's part of my enjoyment here. It's kind of like my living with Lyme University because I can give
Right.
myself, core credits from learning from all you guys.
That's fantastic. I'm so happy we were able to connect.
This is so good.
Wonderful.
Oh, for everybody, this is another episode with Summer DelSignore. I love saying that. And come back, listen to us again. We're always here to inform you and help get you through your illness. And also check out www.pursuewellness.us if you're interested in some integrative care for near or far, because we have a virtual platform. So everybody take good care, stay strong, stay healthy. Bye now.